Hi, my name is Jordan Heidi, and I am here to discuss the QI plan. Starting off, I want to talk about the basic models of quality improvement in healthcare. The common one is the Plan, Do, Study Act, the PDSA. Quality improvement projects and studies aimed at making positive changes in healthcare processes to affecting favorable outcomes can use this model. This is a method that has been widely used by the Institute of Healthcare Improvement for rapid cycle improvement. One of the unique features of this model is the cyclical nature of impacting and assessing change, most effectively accomplished through small and frequent PDSAs rather than big and slow ones before changes are made system-wide. The purpose of the PDSA quality improvement efforts is to establish functional or causal relationship between changes in processes, like specifically behaviors and capabilities and outcomes. The Six Sigma, originally designed as a business strategy, involves improving, designing, and monitoring processes to minimize or eliminate waste while optimizing satisfaction and increasing financial stability. The performance of a process or the process capability is used to measure improvement by comparing the baseline process capability before improvement with the process capability after piloting potential solutions for quality improvement. Next is the root cause analysis was reported to be useful to assess reported errors/incidents and differentiate between active and latent errors, to identify need for changes to policies and procedures, and to serve as a basis to suggest system changes, including improving communication of risk. A failure modes and effects analysis, or the FMEA, was used to avoid events and improve or maintain the quality of care. The FMEA was used prospectively to identify potential areas of failure where experimental characterization of the process at the desired speed of change could be assessed, and retrospectively to categorize the safety of a process by identifying potential areas of failure, learning about the process from the staff's point of view. This is just how the PDSA looks like and works, which is the model for improvement. Next is the patient satisfaction, is to assess patient experience. One must find out from patients whether something that should happen in healthcare settings, such as clear communication with the provider, actually happened or how often it happened. Satisfaction is about whether a patient expectations about a health encounter were met. Two people who receive the exact same care but who have different expectations for how the care is supposed to be delivered can give different satisfaction rating because of their different expectations. So the patient experience encompasses the range of interactions that patients have with the healthcare system, including their care from health plans and from doctors, nurses, and staff in hospitals, physicians, practices, and other healthcare facilities. As an integral component of healthcare quality, patient experience includes several aspects of healthcare delivery that patients value highly when they seek and receive care, such as getting timely appointments, easy access to information, and good communication with healthcare providers. Understanding patient experience is a key step in moving toward patient-centered care. By looking at various aspects of patient experience, one can assess the extent to which patients are receiving care that is respectful of and responsive to individual patient preferences, needs, and values. Evaluating patient experience along with other components such as effectiveness and safety of care is essential to providing a complete picture of healthcare quality. The CAHPS surveys have become critical tools for organizations interested in assessing the patient-centeredness of the care they deliver and identifying areas of improvement. The CAHPS surveys do not ask patients how satisfied they were with their care. Rather, they ask patients to report on the aspects of their experience that are important to them and for which they are the best and sometimes the only source of information. Because the surveys ask well-tested questions using a consistent methodology across a large sample of respondents, they generate standardized and validated measures of patient experience that providers, consumers, and others can rely on. So 5 ways to improve patient experience. Improve access, meaning patients need to know your facility and providers are available. This means some places have extended clinics and hours and opening appointments to improve patient satisfaction. Improve wait times, meaning evaluating appointment lengths and appointment times to schedule appropriately. Improve communication, meaning having communication with the patient from the time the appointment is scheduled until the patient receives follow-up must be timely. Training the staff on empathy, because patients want to know that their providers can understand their feelings. And improve cost transparency for patients who want to know the cost of treatment and visits with providers. Healthcare organizations must provide new tools to share costs of patient care. Next, another important part is the statistics. Statistical methods in quality improvement are defined as the use of collected data and quality standards to find new ways to improve products and services. There are formalized body of techniques characteristically involving attempts to infer the properties of a large collection of data. The use of these methods in quality improvement include hypothesis testing, regression analysis, the SPC, which is statistical process control, and design and analysis of experiments. The hypothesis testing is hypotheses are evaluated, a null and an alternative hypothesis. The null hypothesis is a straw man using statistical tests. The conclusion is to either reject or fail to reject the null hypothesis. Regression analysis determines a mathematical expression describing the functional relationship between one response and one or more independent variables. The SPC monitors, controls, and improves processes through statistical techniques. The SPC identifies when processes are out of control due to special cause variation caused by special circumstances not inherited to the process. Design and analysis of experiments, planning, conducting, and analyzing and interpreting controlled tests to evaluate the factors that may influence a response variable. Measurements. Quality measures typically fall into 4 broad categories: structure, process, outcome, and patient experience. The structure measures assesses the structure and characteristics of a healthcare setting. Process assesses the services provided to the patients. Outcome measures assesses patient health resulting from treatment, and the patient experiences assesses quality based on patient feedback regarding their experience. All quality measures begin with evidence. A number of groups are involved in finding and creating an evidence base upon which to develop quality measures. Government agencies, pharmaceutical companies, academic institutions, professional societies, and advocacy organizations all participate in developing the evidence base, which is then used to develop clinical guidelines. Next is the measurement methods that are commonly used. The first one is the key performance indicators, or KPIs, 5S or success method, and the balanced scorecard. The KPIs are metrics that are used to meet the goals of the department or division. The metrics include several areas throughout the organization, and the metrics are calculated provide data on healthcare quality. The 5S or 6S method looks at simplicity and organization to reach improvements within a department. This method is evolved from Toyota Lean methods in Japan, where the 5 S's stand for sorting, set in order, systematic cleaning, standardizing, and sustaining, which translates to tidiness, orderliness, cleanliness, standardization, and discipline. When an organization uses the success method, they add the concept of safety and security. When this type of process is done, it makes a large impact on the division of or department on which the focus was placed. The balanced scorecard takes a different approach than the other performance tools that were discussed. The balanced scorecard places a focus on the mission and vision of the organization and all types of successes. The scorecard sets out specific dimensions to get results, which in healthcare often include a patient financial process and an innovative component. And that is all. I hope you guys enjoyed, and until next time.